My name's Enzo, and this is a story about the people in scrubs who ask you, do you floss regularly? They are called dentists, but what do we actually know about them besides stereotypes of being scary people with a plethora of tools? I asked a couple of my friends, and here's what they had to say. What do you think when you hear the word dentistry?
I think of my local clinic and when I go to get my teeth cleaned.
I think about people cleaning my teeth.
I think medicine, because obviously I'm going into medicine, so.
Have you ever been scared of the dentist before?
Yes. Yeah, when I was younger, but not for the cleaning part. I was scared of the chair going up.
Yeah, probably when I was having to go do my braces.
I remember this one time when I was in the 3rd grade. I had to go to the dentist to take out my tooth. I was scared of them just grabbing it and ripping it as hard as they can.
Yeah, I've been scared of the dentist when I was little, but that's just because I had really strange experiences with my other dentist, but then my new dentist is a lot better, so I don't carry that fear with me anymore. Recently, I had my wisdom teeth removed, and they're like, if any point, if it hurts too much, just let me know. And I thought that was pretty cool.
Would you ever consider a career in dentistry?
Probably not.
No?
I did, like a while ago, but then when I did more research into the career, I realized that they have to do school for a long time, and I'm low-key not trying to do all of that, so I don't know.
I don't know. I just feel like it's very repetitive, and I kind of want my job in the future to be different or do something new all the time, and I don't really think I could do a repetitive job for the rest of my life.
It would seem like something that wouldn't be to my interest. I feel like I'm always so scared of the dentist, and me becoming one, I don't know about that.
How often do you floss?
I floss every night.
I used to floss every day, every morning and night, but recently I just got a little bit lazy, so probably every night.
Every day.
Twice a day, morning and night.
Every night.
Are you sure about that?
No. Well, yeah, every night.
With that, this story will be a journey passing by 3 checkpoints for you, the viewers, to learn about. By the end of this video, some of you, not all of you, will be invested in this unique profession. I hope to become a dentist one day myself, and this could also serve as a guide for others with the same dream. So come with me as we dive into what a dentist is defined as and what they can do on a day-to-day basis. Let's dive into the branch of healthcare known as dentistry. Dentistry is a field specializing in oral care, which involves the mouth as a whole, including the teeth, gums, and jaw. There is a wide range of trained professionals that branch off and focus on specific areas such as orthodontists, which focus on adjusting the misalignment of teeth with braces and other equipment. Prosthodontists, who replace and restore missing or damaged teeth. Dental hygienists, who mainly clean your teeth. Finally, the one that this video will explore, dentists, focused on dental procedures like fillings and the removal of teeth. They are also primarily involved in preventing oral issues by educating the public about proper hygiene, aesthetic improvement, surgery, reconstruction, and detecting and managing oral conditions. Dentists are able to practice privately on their own or in a group, and some private practitioners are able to choose their own hours even. Before I go further, we have to start from square one and talk about how a person becomes a dentist in the first place. Before becoming a dentist, you must attend dental school. For this example, let's talk about UBC Dental School. There are specifically 90 credits of required courses to be taken before applying, such as biology, chemistry, biochemistry, organic chemistry, and English. However, although this means you do not need to become a major in the Faculty of Science, science majors often find success since their major covers most of these prerequisite courses already. Extracurricular activities such as hands-on research, assisting professors in labs, or shadowing a dental professional are suggested as well to stand out amongst other applicants. You also must pass the DAT, aka the Dental Aptitude Test, which tests you on 4 categories: survey of the natural sciences, quantitative reasoning, reading comprehension, and perceptual ability. You must also be interviewed by faculty and dentists where they ask you questions like, why are you interested in dentistry? And what would you tell an angry patient to calm them down? Once past the interview, you are officially accepted into dental school. After around 4 years, you can receive a DMD degree or Doctor in Medicine of Dentistry degree. To begin your practice as an actual dentist, you must pass the NDEB exam or the National Dental Examination Board of Canada exam. This exam contains 200 questions assessing you clinically, assessing you on theoretical thinking, and dental assisting knowledge. You also must be approved through getting a provincial registration, which is basically a final check for your degree, exam, criminal background check, ID, and confirming other important information. Finally, after all that, you can officially be called doctor. Wasn't that hard, right? As a part of my research, I shadowed my family dentist, Dr. Jody Mao. She graduated from UBC Dental School herself. So while I shadowed her, I asked her a few questions to better my understanding of how a day in the life of a dentist is. I didn't get to record her answering my questions, so what we're gonna do is use sock puppets to reenact our interaction. So, what do you normally do in a day? Well, to start off the day, at around 7 to 8:30 a.m., I check over my schedule, which includes reading patient charts and looking over their medical history to plan treatment later. On a side note, I think a good analogy for treating different patients is like washing the dishes. You can't wash a metal pot the same way you wash a glass cup. That's why dentists have to check their patient charts, as some patients may have underlying medical conditions that could affect the way a dentist needs to treat them. Let's say, for example, a patient has a pacemaker, and then the dentist won't be able to use specific vibrating instruments which can affect the pacemaker, which can negatively affect the patient. Okay, back to the puppet show. Then, patient appointments start around 9 and end around 4:30, with a lunch break in between around midday. I may perform procedures such as root canals, fillings, and extractions. Some patients are new, which require thorough examination like taking multiple x-rays of their teeth to get a baseline to see how they are, and I also help with their concerns. Follow-up patients also come in, and these appointments are mainly checkups to compare from their last visit. There are also emergency patients which could have severe toothaches, broken teeth, and these situations are why dentists need to be prepared for unpredictable circumstances. After treating the final patient, I update patient charts, sterilize all equipment, and I finish the day around 5. How do you explain complex procedures to kids? And how do you comfort patients that are afraid of the dentist? For both situations, it's best to talk in a calmer tone to make them feel comfortable, and using things like letting them raise their hand if they feel uneasy, to pause the procedure and resume when they are ready. For toddlers and younger children alike, sometimes it's better to use vague terms for some procedures, such as using the term numbing juice instead of anesthesia to make it easier for them to understand. Normally, when a patient knows what's going on, they feel more comfortable with the procedure and they don't fear the unknown. Even connections to past experiences, like saying the oral injection is just like a vaccine for the mouth, will make the patient feel less afraid of the procedure. Some kids also know a lot more than you would think, and the internet helps out a lot because less kids are scared of the dentist and more informed about what is being performed on them. All in all, the main takeaway is to not scare the patient. How are cavities treated, and how are fillings done? First, when a cavity is found, a metal band is placed around the affected tooth. Then, 2 types of dental burrs are used to reach the inner affected portion. Burrs are divided into 2 categories: burrs that are used for cutting, and burrs that are used to shave away softer tissue. A coarse burr will be used to cut through the first layer of the tooth to reach the cavity tissue. Once the softer tissue is reached, a slower spinning ball burr made out of titanium carbide is used to shave away the tissue, leaving a divot. This is where the filling comes in. An explorer is used to fully clean the tooth. Then gauze is added next to the tooth as a blue gel called etch is applied as the conditioner for the tooth. A filling composite is added onto the tooth either using a syringe or a composite gun, depending on how big the original divot was. Then UV light is used to quickly dry the composite. Finally, the composite is molded and sanded to create the natural grooves of a tooth. What is something no one talks about for dental school? Once you begin, there's no going back. The program costs a lot of money, and you are spending it. If not you, your parents. You don't want to waste money just to quit. So once you go, you gotta just stick with it. Wow, that was a lot of info. Not enough though, we need more. Now we know more about how dentists treat patients and go about their day. Let's dive deeper into the teeth themselves.
Knock, knock. Who's there? Tooth. Tooth. Tooth or dare. Yep.
When you're still growing up, you'll have a set of 20 baby teeth, and when you become an adult, this number grows to 32. Well, it can vary between 28 to 32 depending on your wisdom teeth and if they need to be removed or not. This set is comprised of different forms of teeth which serve different purposes. Your central and lateral incisors are tasked with cutting food into manageable bite-sized pieces to chew and swallow. Your canines form the corners of your mouth and have the longest roots. Their job is to tear up food. Your premolars, or bicuspids, are located between your canines and molars and are tasked with a mix of tearing and grinding food, while your molars, which actually have 90% of your mouth's chewing power, are at the back of your mouth and are similarly tasked with grinding your food. Wisdom teeth are actually the very last molars of your teeth, the third molars, in fact, and the reason why they are often removed is because they clash with the space available in your mouth, and they can erupt at uncomfortable angles. The upper and lower set of teeth are also split into the maxillary and mandibular sides. Your teeth are also split up into quadrants, but we will talk about that later. All your teeth are comprised of different layers. The crown is that portion above the gums, the part you can see. The root is the part hidden inside the gums, rooting or anchoring the tooth to the connective tissue. The harder outermost layer is called the enamel, responsible for protecting the tooth, shielding it from bacteria that enters your mouth from the food you eat. The next layer is called dentin. Although it's not as strong as enamel, broken enamel that exposes the dentin layer can lead to an increased cavity risk. Cementum is a layer covering the root of your teeth, additionally helping anchor your teeth to your gums. Finally, the tooth pulp, the innermost layer, is comprised of nerves, blood vessels, and other connective tissue. This is the layer that is removed during a root canal, and the bundle of nerves is the reason why this procedure will be one of the worst things you will ever feel. Your teeth are also numbered in a special way too. Have you ever been to the dentist and heard them say something like this when they check over your teeth? 1 2, 1 1, 2 1, 2 2, significant overjet. They're talking about your incisors. Remember the quadrants I was talking about? Based on the quadrant, 1 through 4, all 4 types of teeth are numbered accordingly, creating a universal system dentists can use to easily note down information about specific teeth. Each tooth is assigned 2 numbers. The first number designates the quadrant it is located in. Say, for example, we're talking about a central incisor on the right side of your maxillary row of teeth. It would be given the number 1. Then the second number designates its position in the row, respective to the quadrant, starting from 1, ending at 8. Going back to the central incisor, since we start counting from the center, the tooth would be given 1 as well. Therefore, the tooth can also be known as 1, 1. This numbering system is called FDI, which stands for Fédération Dentaire Internationale. It is an international system which Canadian dental clinics mainly use. However, in some countries like the US, they use a system which disregards quadrants and counts from third molar to third molar. It goes from 1 to 32. Now we can dive into common tooth disorders. One people are mainly familiar with is bruxism, or grinding your teeth. This subconscious act can wear down your enamel, which increases tooth sensitivity and vulnerability to damage. Impacted teeth are teeth that don't erupt properly, aka wisdom teeth, and involve removing the tooth if it causes too much pain. An orthodontic misalignment involves crooked, gapped, crowded, and rotated teeth, which negatively impact chewing and oral health. The main solution to this is braces, which I got myself for 2 years. An abscessed tooth involves a bacteria invasion, where bacteria invades your pulp through poor oral care, and bacteria build up over time, bypassing the enamel entering the inner tooth. This can cause cavities and create a pocket of pus and pain. For dental professionals, to treat some of these disorders, a variety of dental instruments are needed to perform the procedures. These instruments are split into 4 categories. Diagnostic instruments are most commonly used during follow-up appointments or to observe a patient's teeth, including mouth mirrors, probes, and explorers. Explorers are specifically used during cleanings to remove plaque, while mouth mirrors can help observe hard-to-reach places. Probes are mainly used to check the depth and health of a patient's gums. Scaling instruments are mainly used to remove calculus, stains from teeth, and bacteria. More specifically, these instruments can clean areas diagnostic instruments cannot. Supragingival scalers, or sickle scalers, have a pointed tip specifically used for cleaning the area above the gum line, since supragingival literally means above the gum line. Root and hoe scalers, as their names imply, are the opposite of supragingival scalers as they clean calculus in the deep pockets of your gums. They have blades that are slightly bowed to make contact with 2 points on the side of the tooth, and hoe scalers are also designed to be used with a pull stroke, which means the instrument is pulled upwards towards the crown, removing the calculus. Curettes have the same purpose as scalers, but for softer tartar, rather than calculus. Their job is to reach the deeper pockets in the gums to remove tartar, as they are designed with a rounded toe to do so instead of a pointed tip. Surgical instruments are used for procedures that involve tooth removal, dental implants, and operating on the tissue inside the mouth. For example, dental elevators are used to create pressure using a lever technique in order to remove a tooth. Dental syringes are used to administer anesthesia in the mouth. Going back to the dental burrs I was talking about earlier in the cavity section, they can be categorized by color based on the level of coarseness. For example, black means the most coarse. As I said earlier, the coarse burr was used for drilling into the first layer of tooth to reach the cavity tissue. Gray would mean medium coarseness, and red means fine coarseness, or it is mainly used for precise, smooth detailing of the teeth. The different tips also reflect this color, as the most coarse burrs are encrusted in diamonds, which help cut, while ball burrs are mostly used for cavity tissue, doing a similar job to the finer burrs. There is also a small rubber attachment which can be used for polishing. Wrapping up our anatomical lesson, now we enter the final section, proper oral care. So most people can relate to being asked the question, how often do you floss? Like I asked my friends in the beginning of this video.
I floss every day.
Well, honestly, most people, including myself, could say occasionally, even though we know for sure we do not floss every day. However, this habit could backfire since not flossing prevents you from cleaning a third of your tooth. This can lead to a buildup of plaque or bacteria, creating a film on your teeth as a byproduct of leftover bits of food. If left uncleaned for about 24 to 36 hours, this plaque hardens into calculus. I've said this word before, but maybe some people don't know, but it is basically a hardened version of plaque. At this point, only dental instruments can remove the buildup of debris, and brushing will have no effect. Calculus also smells horrible, and its buildup can also cause bad breath, which no one wants. The correct order of oral hygiene is floss, brush, then mouthwash. Even though mouthwash is optional, but flossing, then brushing is non-negotiable. Flossing twice a day is crucial to prevent plaque from hardening into calculus. It's best to make flossing a habit so you don't need to think about it, and you can do it while doing mundane tasks like listening to music. To floss correctly, take a piece equal in length to the distance between your hand and your shoulder. Wrap one end around your left index and another end around your right middle finger, or you can reverse it if it feels more comfortable. Now leave 2 inches in between these fingers and slide the floss in between your tooth, and wrap it around in a C shape and wipe up and down a few times, making sure you reach the pocket at the base of the tooth, and repeat for the other side. After doing this on each tooth, we can move on to brushing. A lot of people have different techniques for brushing teeth. However, there's one method which was formulated specifically to target plaque removal from the gums, and some say using it with a manual brush can be as good as just using a regular electric toothbrush. It's called the modified Bass technique. This technique actually adds on to the regular brushing in circles technique, also known as the Phones technique. You begin by holding the brush at a 45-degree angle facing the gums. Then brush in a small circle/oval motion covering 1 to 3 teeth, and then after several seconds, flick away from the gums. Gentle, but with a small amount of force to remove plaque. After repeating this for the front side of your teeth, move to the back side and brush the top side of each teeth in circles. Bazinga! Now you know a proper dental routine you can use yourself at home. And on another note, we completed the video. So I wanted to do this debrief face-to-face with the camera, and I just wanted to say that video took a very long time, and I put a lot of time in trying to make sure my research was actually correct, and it took a very long time to also just put all the clips together, organizing interviews, even creating a puppet show, which was actually kind of a blessing in disguise, because I was able to make her answers more engaging, in a way, I'd say. And I think, from what I've learned, even though a lot of people might not find the profession of dentistry appealing, like my friends in the interview, I'd say there's a lot of opportunity. There's a lot of branches in the oral care field. Like, if you don't want to actually just be a dentist, you could do dental technology. So like dentures, it doesn't have to be that. It doesn't have to be boring if you don't want it to be boring. And do what you want to do. It was a real eye-opener for me, because for a long time I really thought dentistry was just like a really boring profession. I thought I just wanted to do it for the money. Like, I didn't really see any upside to it. But even with my interview, or even asking my mentor questions, I was able to just realize that since I had a very deep passion for volunteering and for science as well, I just wanted to put those two together. And if I'm able to make people happy doing what I do, then I'm content with that. Okay, that's it. Thanks for watching the video. I hope you learned a lot.